Hey friends, thanks for joining me, Jim Baroud, to hear a few insights from leaders who represent our innovation ecosystem. Today's chat is with Julie Ancis, Professor and Director of Cyberpsychology at NJIT, and Amy Hoch, Associate Director of the Wellness Center at Rowan University. Julie, I'm going to start with you. Tell us about your background.
Sure. Well, Jim, first of all, it's a pleasure to be here with you, and it's a pleasure to be here with you, Amy, as well. My background, I am the inaugural director of the Cyberpsychology program, brand new program at the New Jersey Institute of Technology at Newark. And so that's very exciting. This field is emerging, and the focus is on the intersections of technology and human beings, human behavior. Prior to my position at NJIT, I was the Associate Vice President of Diversity at the Georgia Institute of Technology in Atlanta. Prior to that, I was a full professor at Georgia State University in Atlanta as well. A lot of my research has focused on climate issues, academic climate, climate as relates to clinical settings, patient counselor, patient psychologist relationship, as well as the legal arena. And so for the past couple of years, or a little bit more than the past couple of years, I've been focused on this relationship between technology and human behavior.
Great. Thank you, Julie. And Amy, go ahead.
Hi, yes, thank you for having me also. My name is Amy Hoch. I am the Associate Director of the Wellness Center at Rowan University here in Glassboro. I've been here for about 10 years. I'm a psychologist by training, and my area of interest and expertise is in trauma, in particular sexual violence. I'm the co-chair of the Sexual Violence Prevention Committee on campus, and I was past coalition chair for the American College Health Association Safety and Violence Coalition. And I oversee counseling and psychological services here, as well as our crisis services. So thank you for having me.
Great. Thanks for being here. So there's so much to talk about. But let's start with, loneliness in general, right? And then we can sort of talk about the related mental health issues that are affecting all of us. So I'm going to go back to Julie. Go ahead. Why don't you kick us off here?
Okay, well, this is such an important topic. I'm so glad you're focused on this topic. We have a crisis around loneliness in our country, but not exclusively in our country. So there have been a number of large-scale studies. The BBC conducted a study. Harvard recently completed a study. The American Psychological Association just completed a study on stress in America that shows that loneliness is a real problem. We have about a third of the population who are saying that they're lonely much of the time, and this is only increased with the pandemic. And we see particular populations such as Gen Z having a really hard time around issues of loneliness. And I should also help define loneliness. Loneliness is oftentimes defined as the gap or the perceived gap between one's actual relationships and one's desired relationships. Many of these studies look at loneliness not necessarily as being alone, but from the perspective of feeling disconnected, feeling left out, feeling not in tune with others. And as I said, many, many people are experiencing this.
Thank you, Julie. Okay, Amy, from your perspective?
Yeah, I would echo what Julie said and add that, Vivek Murthy, our 19th Surgeon General, addressed this as a public health issue after his tenure. And he wrote a book called Together just about this very issue, kind of speaking to this as long before the pandemic came along, that he is seeing this as really often a core issue with regard to many other health problems that show up for people. And he breaks it down, loneliness, into three parts. One kind of loneliness is certainly what we think of in terms of emotional loneliness. You know, we're hungering for a deep, kind of meaningful personal relationship with one person. And then we also have social loneliness. You know, we want quality friendships in our lives, and that's important. And the third kind of loneliness is, you know, really about community, wanting an affirming community that helps give us a sense of purpose and meaning. And you think about all three of those kinds of loneliness, they've all been affected by the pandemic. And they've also all been part of, I think, what we've seen over the last 10 years, really, with regard to a rise in mental health issues overall. I work at a college counseling center. So for students, we see that in terms of rising depression, anxiety, suicide rates. And I would also add, as Julie mentioned, this is a global phenomenon. So I think the other piece is that she mentioned, right, expectations. Well, this has a lot to do with culture as well, because, you know, our culture and traditions shape our expectations. So when our cultural expectations, you know, kind of interfere with or are not the same as actually what happens in kind of our day-to-day life, that matters a lot. So for example, if culturally, you know, you're kind of, would be the norm to be married by a certain age, but you're single, right? You might feel lonelier, you know, or more stressed because of that versus somebody else where that cultural expectation isn't, you know, a part of what's happening. So I want us to kind of think about that piece around culture too, and how that can impact this loneliness.
Sure. So thank you for that. So you mentioned the pandemic, and we know this has affected all different generations, right? So let's break this down a little bit. How, from your perspectives, how has it affected each of those generations, you know, that we see? I know you're both at college campuses, so you see young people in general, but maybe give us sort of a framework and, you know, some things that you're worried about, you know, you've been worried about and worried about going forward.
Well, I am not seeing students in a clinical sense, but I'm teaching students, and we have a lot of these conversations in my class this semester, and the class is Foundations of Cyberpsychology. So I'm very interested in getting their perspective. They're the Gen Z, for the most part, generation. They're the ones engaging in technology. They're having their own unique experiences that many folks who are not part of that generation, including me, obviously, can't necessarily relate to. So this is a generation that grew up with incredible uncertainty, and they talk about that uncertainty in terms of, what is my future going to look like? Am I going to have a job now, especially with the pandemic, when this is all said and done? They've been exposed to tragedies which they see online in epic proportions: the school shootings, sexual harassment, rape, climate change. And they're just dealing with a lot, in addition to just being an 18, 19, 20-year-old struggle. So the struggles of this particular age group, the particular context of this particular age group in terms of the uncertainty, the overexposure to social media that's been negative, and the pandemic have just piled on top of each other to create this feeling of really not being cared for and being very disconnected oftentimes from society and from other human beings.
Right. Amy, I'm sure you see that as well. And I guess, you know, as you say that, Julie, I think of, you know, they've gone through the Great Recession, right? Sort of, you know, a lot of their parents probably lost their jobs then, a lot of uncertainty, and everything in between then and now. You're right. It just seems, you know, super difficult. Of course, they're more resilient. So Amy, take it from there.
Well, I think that uncertainty can certainly breed more anxiety and depression. And I think you can have loneliness, but with this pandemic, we've also had isolation, right? Physical and social. We sometimes talk about social distancing as it being physical distancing, but they're really two separate things. And we can still be social, right, virtually, just like we're doing right now. But that physical distance actually matters a lot. Physical touch, having actual, real-time facial interaction with people, and even just a felt sense of someone in your environment has a huge impact on, you're feeling good. So I guess I'll go to the other side. Social connection is actually the best predictor of well-being across all age spans. So for our college students, again, going back to expectations, the idea is, for those who were in high school, last year and about to graduate, they didn't get a prom or a graduation or the things that are expected as rituals that help us kind of move through our life. And then our college freshmen this year have really struggled with a lot of different aspects of not having a community, not being able to, walk out of your dorm and meet with a group in person and talk and chat. And the virtual learning is really, really difficult for many of our students, who have learning challenges, but also who just, are having trouble staying engaged because they're more depressed. You have our elderly population. My aunt is in a nursing home and had to be in a nursing home through this whole year. The isolation due to the need to create safety for them physically has created more dementia for people, more disorientation, more depression, more anxiety, and all of that actually takes years off of a person's lifespan, that disconnection, loneliness, and isolation, and has far-reaching health problems, long beyond this time when the actual pandemic is happening. Things like coronary heart disease, things like autoimmune issues, things like obesity. So we will see the after effects of this, I think, for a long time to come.
In fact, can you comment on those other generations, what you're seeing? I know that may not be your focus area, but what are you seeing in those how are those generations being affected differently?
Well, I think if you think about, people who are, kind of working, about to have, children or thinking about having children, you think about kind of work-life balance and how that's been hugely impacted by almost everyone having to work from home. If they have children, teach their children from home, manage that balance in terms of, responsibilities in a home space that may have already been crowded. For lots of different reasons. And then the lack of social support that they may have been able to have before because of extended family living nearby, or, friends who might help out sometimes. People are really having to take on more and more alone. And their happiness with work, may certainly have changed as well, because we know productivity, and connection with people, those things go hand in hand. So the kind of generation that is kind of in the midst of working and having children is definitely affected in different ways. And then certainly, I think we sometimes think that the younger people are the little kids who are, kind of not so much aware of what's going on. Certainly, they may not be so aware. They may be able to, on the surface, seem more flexible and kind of manage things. But what we also know about any kind of trauma or traumatic loss, and I would say that this is that happening for all of us on a global scale, that just being in a situation where everyone around you is more stressed than usual elevates our own cortisol levels, our own stress hormones, so that everybody's kind of sitting in this marinade of, extra stress and loss. And that on a physiological level is really, what I mentioned in terms of creating these other potential health and mental health problems over the long run. So, I also see that with the isolation, has come this sense of added fear to getting back to normal. We've had this experience now for almost a year of avoiding people, of almost, even if someone says hello to you, think about your reaction to it now versus how it was before, about getting close to people. That has an impact on us on a physiological level also. We feel shame from that. There's an actual shame response that happens in our bodies that is difficult to get over. So I also see workmates, college students, my aunt, as I mentioned before, now being afraid to come out of a situation where we can now connect more because they're fearful. That's been kind of reinforced over time. And I think that will have its own impact.
Interesting. Julie?
Yeah, I agree with everything Amy said, and she said a lot of very important things. And I particularly agree with the fact that we're going to see the effects of the trauma of this pandemic, the psychological trauma, the economic trauma, the spiritual trauma, the health trauma. We've had so many people who've been very sick. We've had people in hospitals who've died in hospitals, unable to make physical contact with their loved ones on Zoom, with a nurse holding up a computer, saying goodbye to their father, to their mother, to their aunts. This is really devastating. And you also think about, as Amy said, going back into society and now connecting with humans. And a lot of people are making jokes about that. They went outside for the first time. They had an engagement with somebody in interpersonal engagements, and they kept talking and talking and talking because they didn't know how to navigate, or they forgot how to navigate, or they were so excited about seeing and talking at length to another human being. What's also interesting to think about, and not much has been written about this, is what about the introverts, the people who have social anxieties? In some respects, you could say that this disconnection, this physical disconnection, has been comforting for those people. It's been like a relief. I don't have to go out. I have to talk to anybody. I could say something's wrong with my camera on Zoom, or my audio's not working. But seriously, thinking about that and how that may have perpetuated some people's already existing, right? Introversion, social anxiety, and disconnection. And what does it mean for those folks right now to get back into the way things used to be, if you will?
Right. And now, Julie, you are an expert in cyberpsychology. I'm sure, some of these things, computers have helped, right? Zoom, obviously, and other technology has helped. But I'm sure there's negative aspects to all this technology all the time during this pandemic, how it's negatively affected all generations.
Yeah, I mean, the relationship between human beings and technology is complicated. And there have been incredible developments, thank goodness for Zoom and WebEx and these platforms. Thank goodness we're able to teach. We're able to put students into breakout rooms. We're able to connect across geographic lines, across time zones. I've seen some of my favorite performers musically and otherwise live on Zoom, and you're able to interact with them and engage with them. Wynton Marsalis, you're able to have a conversation on a social media platform. How incredible is that? So that's all wonderful. On the flip side, this is something my Gen Z daughter said to me, whose head is in the phone much of the time, just like my head is in the phone much of the time, that technology makes communication easier, but connection more difficult. So we're not really interpersonally connected. For folks who are struggling with loneliness, seeing in this selfie generation pictures of people smiling on Facebook, for example, who look like they're having a grand old time, especially pre-pandemic. And a lot of those images are not real images, or they're doctored in some way. And comparing oneself, especially if one is feeling miserable or lonely, to these images just perpetuates more disconnection, loneliness, the emphasis on likes, the emphasis on retweets and sharing one's material online makes us constantly in this sort of hamster wheel of checking our phones or checking our computer. And if we're not getting the responses that we desire, that also perpetuates disconnection and loneliness. So it's a complicated relationship, I think, human beings and technology, that's just getting even more complicated.
Well, that's for sure. Now, what about the broader macro effect on our society and economy? I think you mentioned some of these things, but you hear all the time about depression and burnout and sanity, right? Talk to us about that.
Well, I think that, as I mentioned, the connection, social connection has a lot to do with well-being, and that has its impact on our economy and our workforce. So if you look at the workplace, the people who are the happiest and the most productive at work are also those people who have a higher number of good friends, meaningful relationships at work, and do work that feels meaningful overall. So with the change to having to work virtually, to having to be disconnected, that has an impact on those things. And when we talk about a trauma, global traumatic, loss situation, even before this, there's been studies done by the Gallup poll where they look at just trauma in general and the impact on the economy. Billions of dollars are lost with when you correlate trauma to things like absenteeism, coming late to work, taking sick days, productivity at work, billions. And so here we've had to adapt, quite quickly to kind of managing, and we have done well, I think, overall as a society. We've had to, and yet, right, the immediate impact of that in terms of, economic loss and the people we've had to lay off because there's just not, right, the kind of work to be done given the kinds of things that we can't do anymore the way we used to be able to do them. And then this longer term, as I mentioned, kind of, healthcare cost to companies and to us as a society in terms of healthcare costs and in terms of, just how we, are as a workforce and a nation. And, here's the thing. I mean, I think it's a good question for us to have as a potential positive impact coming out of the pandemic is, do we want to do things the same way? I mean, here at work, I can say we're doing everything telehealth right now, and we may keep some of that, whereas we wouldn't have done that before. So, there may be things that actually are positive that come out of this in terms of creating a teleworkforce where there is more flexibility and people don't have to, be rushing from one place to another to get their kids out of daycare, or spend as much on things like that, and they can manage a little bit better overall. So there's kind of plus and minuses, I think, to the economic impact.
Thank you, Amy. Julie, do you want to add anything to that?
Just in thinking about work, in addition to Gen Z being the loneliest generation, there are other populations that have been really affected, most particularly single moms, especially women who are not educated and are in service jobs, restaurant business, housekeeping, etc. And then you have the rise of e-commerce in addition to that, which is really threatening their economic livelihoods. They don't have the money to afford childcare. And so they're home with the kids who are doing remote education or this converged learning. And that is a challenge. And I think a lot of people are going to have to retool, develop new skills. It may not look like a college education, a full 4-year education. It may mean going back to school, taking some classes online, and retooling. I can't imagine doing this interview with you right now without any support and, a 5-year-old running around, running in to ask me what we're having for a snack. This is, and that's an easy scenario, right? So I think for many portions of our society and many folks, this is going to be a particularly hard time.
Yeah.
Even pandemic.
I unfortunately think you're right. I mean, obviously, K-shaped recovery is what a lot of people are talking about, and I know our hearts go out to those single parents who are struggling, all parents who are struggling, with particularly young kids who, can't stay seated, or
none of us could really stay seated,
or a number of things, right? Or even the poorer communities with lack of bandwidth, one cell phone, instead of a computer. But let's talk about programs or resources that people can take advantage of. I know when we speak about technology, I know we mentioned earlier that maybe one of the silver linings is the acceptance of getting therapy or getting help or using an app. So can each of you speak to that?
Well, in terms of there's so many things to speak of, and I think we really need broad societal responses. But in thinking about technology, as Amy mentioned, and we were talking a bit, the three of us before we all came on, there's been an increase in teletherapy, conducting therapy, conducting counseling online using digital tools. And that has been wonderful in terms of increasing access to help and to care that many, many people are in need of. There's also some interesting developments in the area of artificial intelligence and in the areas of virtual reality. So we have these social robots who are essentially companions for people. Sometimes they kind of look like human beings. Sometimes they look like stuffed animals. And those have been very helpful, especially for elderly populations who are lonely. There are chatbots, a number of chatbots, where one just downloads an application, and the application is able to assess and track one's mood and pop out a prescription, a behavioral prescription. So maybe like you should go out for a walk type of thing. There are virtual support groups where people get together online and support each other. And there's also just incredible developments in VR and immersive technologies, which help to not only treat, but to prevent a variety of disorders, like PTSD, for example, with vets. And it's been very effective in these VR situations and settings, and virtual human agents and in the form of therapists are making a very strong impact. So I think that's all good. I also think there are limitations to those technologies as well.
Great, thank you. Amy?
Yeah, I think telehealth is here to stay. And, as Julie said, there are a lot of ways that we see students and, my friends and, many generations can kind of access support via an application on their phone, talking to someone. We know that there has been a decrease in requests for services from college students nationally. And we think that has to do with students accessing, because there is telehealth and they don't have to get the service necessarily from us anymore. They're not necessarily here physically on campus, but that they can access telehealth anywhere now. So I think many places will be able to see people requesting that service and utilizing it. I think that a lot of this generation, it's perhaps for some more difficult to reach out and ask for help. And so, a virtual platform can be helpful in that way. And yet we have a lot of students coming in from, the orientation who say, I was in therapy in high school. This is what I'm looking for. There's less stigma attached to that. And so they are better consumers of mental health care also. And so their ability to demand what they want, and secure that is better. We have, suicide rates are up even prior to the pandemic. And so being able to access a person via a phone call, via a chat, via a text line becomes hugely important right now. And there are specific crisis lines. There's the National Suicide Hotline. There is a crisis line specific for students who are African American or identify as Black, for those who are LGBTQ, there's the Trevor Project. So there are resources like that for situations where somebody needs to reach out and maybe has a little bit more difficult time doing so, or is in a crisis. And one thing I would say is that we know that actually contributing, being able to do something for somebody else actually has far-reaching positive consequences. And so using digital platforms to reach out to someone else to see how they're doing, peer support groups, building communities digitally or in person, has an impact on the person who's suffering just as much as it might on the person who's receiving that. So I think many counties have a volunteerism, department. We have one here at Rowan University. So I would encourage students, faculty, and staff to look at ways of providing community support, volunteering, reaching out to those people, just even in your inner circle, because the benefit of that to your own mental health is huge. And again, it forges that social connection that we know, mitigates the loneliness that we're seeing.
Well, that makes a lot of sense. So before we get to questions, and I'm sure there'll be a bunch, I want you to share with us just one thing that everyone should take away from this conversation about how to address or combat loneliness or mental health issues. Julie?
So I would say focus on relationships, real relationships, connecting, not through Zoom or WebEx necessarily. Sorry to keep naming those particular platforms, but they're biggies now. But focus on really deepening relationships, building and expanding your relationships. It's more important now than ever, particularly in this technologically oriented society where we are communicating, but are not necessarily deeply connected.
Thank you. Amy?
I would reinforce what I just said about kind of giving. And one simple way to do that is to practice loving kindness or compassion. Actually, just thinking for a minute about a situation where you may have felt kind of warm feelings about someone or towards someone, just calling that to mind, during the day for a minute, kind of savoring what that brings up for you, has a huge impact on your mood, your openness going forward for the rest of your day, and your ability to connect. And I think, as Julie mentioned, for those people who might be more introverted or who actually may be more socially anxious, taking that step and trying to reach out to people is really difficult. So that kind of practicing that compassionate, loving kindness is a skill that has a lot of positive impact on us physically and mentally.
Great, thank you. Great advice. So here's the first question we have. It's about, are there any, you mentioned some things, but they ask, are there daily measures we can take to help offset, these mental health issues or traumatic influences that have affected us, particularly this past year?
Yeah, I would say name the experience. I think we need to decrease the stigma around loneliness and a host of other challenges that all human beings experience to different degrees. If you have millions of people around the world experiencing feelings of disconnection, loneliness, maybe we should reconsider the importance of normalizing that and decreasing the stigma. And I see that there are public service campaigns that are doing just that. Recently in the New York City subway, I saw a digital ad and I wrote it down. And I was so taken by it. And then thinking of our interview in preparation for our interview and our conversation, studies show friendships at work boost happiness and productivity. It's even more important now as isolation worsens. And so that's such an important message for people to hear. It normalizes the experience that so much of us are having. So that's one tip, I would say.
Okay. Amy, did you want to add anything to that?
Sure. I think when I think about well-being, I think about, a couple different components. Julie mentioned an emotional component, just, identifying, naming, labeling helps tame our brain. Separately, we have physical. So physically, we can actually do things to help us build well-being. Getting outside and taking a walk. Exercise is probably one of the best things to do for our physical well-being. So I would prescribe that. I would say fresh air, sunshine, getting your vitamin D3. Don't think that's a small thing, because we know it impacts us and our mood and our hormones, and it helps us feel happier day in and day out. And then really think about what your purpose is. Like, are you doing something purposeful every day that gives you a sense of meaning and that helps you feel productive and that helps you feel happy? So those 3 P's, I think, doing something pleasant, productive, and purposeful gives us an intention for the day that helps us feel, better.
Great. Now, someone asked about organizations. Now, I think you mentioned some organizations, but are there any organizations you want to let us know about in general that people can look to for help?
I think every county has a local mental health association, and that's going to probably be the best place to look for mental health resources, for parenting workshops, for help with virtual kind of learning and how to manage that. They have great substance use and addiction recovery services. So I would encourage people to Google, Burlington County Mental Health Association, or, Essex County Mental Health Association. And they typically have a ton of things on their calendar, free workshops, free options for people to kind of access, not only kind of therapeutic services, but, as I mentioned, kind of parenting and other resources. So if I could direct you to one place, I would say that would be the place to go. In addition to, some of the crisis lines that I mentioned, you have the National Suicide Prevention Hotline, and the Trevor Project is one for our LGBTQ folks. And then we have, addictions hotlines. And so, and I can provide you the numbers of those if we want to put those up or send those out.
Okay, great. And there's some well-known apps as well that could be helpful too, right? Is Talkspace one of those, or are there others that I may not be familiar with?
There's one app. It's called Woebot, WOEBOT, which is relatively popular among college students. And I was referring to that earlier when I was speaking about an app that tracks and assesses your mood, and then spits out a prescription, a cognitive prescription related to the way one may be thinking that's not very healthy or helpful, and or a behavioral prescription. And then that app assesses your mood via questionnaires online post-prescription. So that's one particular app.
Great, thank you. Here's another. How do folks balance the need for professional boundaries versus connection with coworkers? That balancing act is a challenge that I think all of us face. And do you have any guidance for that?
Yeah, I think that's a good question and a challenging question. What I see more of in the past couple of years is more disconnection. So there are not even boundaries to blur anymore, because so many of us are busy with our technical devices and we're not reaching out. We're not going out to lunch with colleagues, we're not making those connections like we used to. And again, for certain populations, like working parents who are in a particular position or work setting where they have to come in and get very focused on their work because they have to pick up their child at a certain time. So I'd like to see, more reaching out among colleagues versus less.
Okay.
I don't know if Amy has something to say about that. I didn't necessarily directly answer that question. It's a challenging one.
Well, and I wasn't quite clear if the boundaries was about, how do you set boundaries with coworkers, or right, how do you manage kind of the time, as you were talking about, Julie? Because I think trying to think about all the things you're having to do in the course of your day, and how do you build in time for connection with others so that you're getting your other stuff done, but also being able to intentionally set aside some time with people at work. I think one thing about boundaries is, know what yours are. If you don't know what your own boundaries are, it's going to be hard to convey them to somebody else. So if you kind of take some time to really think about, like, what's important to you, in the course of your day. If family is first, if connection or friendship is, important to you, then how do you nurture that? How do you make time for that? In the course of a day or a week. It doesn't have to be every day that you're setting aside time for those things, but I would say, with some intention, if you kind of live the value of that, rather than just kind of doing what is put in front of you, which I think we're all prone to be doing right now. Because, frankly, our society is a society that now there are even more difficult boundaries to hold sometimes, because work is happening at home, in your bedroom, perhaps, right? Because you don't have the space to have your office elsewhere. So when do you stop? When does work stop? When do you stop emailing? When do you stop checking your phone? Your phone is also maybe your computer. It's also, right, your way to make a phone call itself, however old school that may be. So I think, one, you have to kind of be clear about what is priority for you, and then really try to hold yourself accountable to that, maybe have other people help you hold accountability to that, so that you feel like at the end of the day, there really are breaks from work and family, friendships, other things that you care about are protected, so you can, not burn out, as we were talking about. You can sustain, this ultra marathon of races that we are all kind of in at the moment.
And thank you for that, Amy and Julie. There's a follow-up comment about that, just to clarify this, because I think people are challenged by this as far as friendship at work, right? What does that mean? Are friendships at work different by nature than friendships outside of work? And I think that's a struggle that we've been dealing with pre-pandemic, but now maybe it's exacerbated or worse or better during the pandemic. So maybe if you can touch on that a little more, that'd be interesting.
Yeah, I'm thinking, and I think you're right. This was a struggle pre-pandemic, and it's going to continue to be for a lot of people. Maybe what makes this time very different for the majority of us is that so many of us are feeling very vulnerable, psychologically, psychically, in so many ways, because of what we've been through. And some of us have been through more trying times, quite frankly, than others. And so noticing that about ourselves and our relationships at work, what are they satisfying in terms of our needs? And are we maybe making ourselves, in some situations, quite frankly, more vulnerable than we should be? And what does that mean? Should we seek some assistance, some support outside of work for that, so we don't get into a situation that we may regret later? So having some self-awareness about your experience, and one way to do that is, again, through naming your experience and understanding that your experience is normal and not one to be ashamed about.
Great. And what about, obviously we've had a horrific week. On the other hand, this happens maybe every week. We just don't hear about it in the news so much. Violence, right? That may stem from mental health and bullying. I know bullying online, this is one of your areas, Julie. So is there anything people can do to sort of protect or counter or resolve or deal with this reality of our time?
I think we must be more intentional about our phone use. There's no question about that. All of us, we have an intimate relationship with our phone. Our phone, especially for younger generations who grew up with a cell phone, has become so much a part of their identity, with sort of parents punishing kids by taking away their phone and noticing the reaction among their kids, which is absolute devastation. Absolute devastation. And parents not necessarily understanding that, because the phone is their connection to the world at large. So we need to take breaks from it, similar to what Amy was saying about, taking breaks, making pauses, making breaks between our personal lives and our business lives. We need to put the phone down when we're having dinner. We need to put it away. Just the presence of a phone creates perception of social distance between people. People feel like they're not being heard. They're not being listened to because the other party has a phone in their hand or is about to look at their phone when they stop talking. So we need to have greater mindfulness around our technology use.
That's for sure. Amy, do you want to add anything there?
Well, I would echo that, and I would say that Julie, I think mentioned this earlier, but the overexposure to images, to sounds, to information. I was watching the news the other night, and there was a reporter repeatedly asking one of the police officers at the scene of the crime in Boulder, Colorado, about, don't you know, like you owe us this information. And I think we're in such an age of immediacy in terms of, kind of getting gratified from this information kind of we're inundated with. And right, there is an addictive quality to that, right? A devastation when we can't get it that is scary in some ways. And it feeds fear and anxiety and all the things that we're really trying to work against. And in fact, I would say, there's a study done that they had people go out into the woods and stare at these like beautiful blue eucalyptus trees for about 20 minutes and, just kind of sitting in this awe-inspiring nature. And what they found is that people are more likely to help other people. They had, a person come by and drop something on the ground, and you're more likely to get help and connection, when we are kind of able to sit in experiences where we feel this kind of, inspiration and, something bigger than ourselves. And so, yeah, not to say that, right, we can't get good information and stay connected with people digitally, but the need for connection with nature and with other people, and things that are actually going to uplift us, rather than, actually vicariously traumatize us. It doesn't take a direct experience for us to be traumatized ourselves. It takes a sound. We can replay a sound in our head that is, horrific, longer than sometimes we, are affected by an experience that might happen to us directly. So we really need to be careful about that.
We always end with a poem or a saying or a quote. So I'm going to ask each of you for that. So Amy, shall we start with you?
Sure. This is actually a quote by Mother Teresa, and it is, if we have no peace, it is because we have forgotten that we belong to each other.
Lovely. Julie?
That's a good one. I wish I had gotten. No, it's a phrase that's often used, that my father, who was very unique, Joe Ancis, in terms of his personality and his perspectives and talents, he always said to me to be true to myself, be true to yourself. And I think that speaks to a lot of the issues that we address today in terms of naming our experiences, having integrity, being honest with ourselves as well as other people, and giving ourselves permission to be our true self in all of its forms.
Wonderful. Both of those are great. Thank you so much, Julie. Thank you so much, Amy. Thanks for joining us. I hope you enjoyed the show. Please like it, leave a review, and subscribe. See you soon.